We have our expert in residence, Dr. Kavanagh, with us now. Good morning, sir.
Oh, good morning, sir.
How are you this morning?
Alive, awake, home, and happy.
Good.
And also safe. That's where everybody should be right now.
Absolutely. Now, the gloom and doom yesterday from the president was unlike anything so far, and the prediction being this is going to be the week from hell. Do you agree?
That's correct. It was said it was the Pearl Harbor moment.
Right.
The interesting thing is just a few weeks ago, if I would have said that, I would have been absolutely inundated with complaints, alarmists, et cetera, but this is really what we're up against. And this could have been predicted and was predicted many weeks ago with modeling. And if anything, listen to the science, because the science has proven to be correct so far.
Okay, so New York being the hot spot, I guess, and what is the new hot spot now? Or is there one?
Well, you also have Detroit, you have New Orleans.
New Orleans, yeah.
And I'm worried about Florida. Both Texas and Florida have stay-at-home orders, but with exemptions for churches. And what we mentioned before, churches may be one of the most dangerous places to be in a confined space with people singing. They can potentially aerosolize the virus, which makes it highly infectious where it floats around in the air. Singing is probably one of the worst activities to do in this, and if you're indoors, spread could certainly occur. Outdoors may dissipate, but indoors you really want to avoid.
And then I heard that the governor of Georgia changed the rule to staying at home, but he opened the beaches. Makes no sense.
Makes no sense, Jack. It makes no sense. We need to have a unified national policy, and this is not right versus left. I'm going to read you a statement here. A pandemic is a lot like a forest fire. If caught early, it might be distinguished and limited damage. If we wait for a pandemic to appear, it will be too late to prepare, and one day many lives could be needlessly lost because we failed to act today. Now, who said that was in November 1st, 2005. That was George Bush. He's the one that set our whole infrastructure for pandemic response. And since that time, it's been neglected and it has fallen apart. And so we really have a little bit of catch-up to do, but we are learning a lot about this virus. Rapid testing is coming, which I think will be key to get people back into the workforce. And a vaccine is being rushed to the market. So, well, I shouldn't say rushed to the market, but rushed as far as being developed. And I would assume it's also going to be rushed to the market once it gets developed. So there's a lot of hope that's on the way. And it's important for people in Kentucky to hunker down. And when you hear all this doom and gloom on the national news, that's national news. In Kentucky, we're very lucky to have our governor, which is keeping us safe. One of the things that we said on Friday was to wear masks, cloth masks, save the viral filtering masks for the healthcare workers, and that I feel that these should be worn in the public. Certainly anybody grocery shopping inside the store should be wearing them. I would have the preference of having retailers require this. I feel that food handlers should be wearing this type of a gear up until we can get this testing done for everybody, wide-scale testing. And this is what's going to have to happen in order for us to return to work.
Anything else you want to share with us this morning?
Well, just stay safe at home. Please, if you go out, wear a mask. We have a lot of resources on healthwatchusa.org, including little videos on how to make do-it-yourself masks and a pattern from Johns Hopkins on how to make this. Granted, they don't train you how to do this in medical school. I'm no expert in doing this. Please research and use your best judgment. These masks are felt not to prevent you from getting an infection, but if you're an asymptomatic carrier, preventing you from contaminating other people. It will help in that regards. And it is very important to realize that there is asymptomatic spread of this virus, and that's what makes it highly infectious. So we need to make sure that we stay safe at home during this critical period, follow the governor's advice. He's just excellent. And believe me, Kentuckians, we will get through this. And when you hear the dire news with the predictions and what's going on in other states, that's other states that do not have a governor and guidance and haven't had a population that has been as responsive to this guidance as Kentuckians.
Dr. Kevin Kavanagh, thank you very much. We'll talk to you again on Wednesday.